Gallstones are very common in the population, and up to 30% of the population can actually have them. However, you only need to have your gallbladder removed if you develop symptoms and complications from these gallstones. These symptoms include pain in the abdomen, particularly after eating a fatty diet, and this pain can spread to the back and to the shoulder blades. Complications from these gallstones also include infections of the gallbladder wall itself, in which the wall of the gallbladder becomes inflamed and in severe situations can perforate, leading to fluid accumulating around the gallbladder. These gallstones can also travel and get stuck in the ducts from the gallbladder, causing obstructive jaundice, in which the skin becomes yellow and your stool becomes pale and urine becomes dark. And also more seriously, these stones can then become stuck in the ducts of the pancreas, leading to pancreatitis, which is inflammation of the pancreas in the abdomen, which is a serious condition and has a certain amount of mortality associated with it. All in all, about 3% of people with these gallstones develop these side effects and complications. Nowadays, the vast majority of gallbladder operations are performed laparoscopically or via keyhole techniques. This is when we use small instruments and cameras which enter the abdomen via small incisions. This means that the patient experiences less pain and the surgeon gets a better view of the surgical field. This is important to avoid cutting the incorrect structures. When we perform laparoscopic surgery, there is a risk that we can cause damage to internal organs such as the bowel or blood vessels, which we can generally fix via the keyhole technique, but in certain circumstances we may have to make a bigger incision. In particular, when we take out the gallbladder, we must cut the duct that it's attached to, and there are many ducts in that area, which if we cut, becomes a serious complication. The risk of that occurring is approximately 1 in 300, and if we cannot fix that duct damage there and then, we would have to send the patient to a specialist unit to have that repaired, which would be major surgery. If there's been some doubt as to whether or not these gallstones are symptomatic, or if there are coexisting bowel problems, then the most common side effect would be continuation of the same symptoms as before surgery. However, up to 30% of people can develop diarrhea following gallbladder surgery. This is because the gallbladder acts as a store for bile, which is being secreted by the liver, and is important in fat digestion. Once the gallbladder is removed, instead of the bile being secreted in response to fatty foods, the bile is being continually secreted in a drip-like fashion into the bowel itself. Now, most people will recover from this, but I would suggest that everyone needs to reduce the amount of fat in their diet to about 40 grams per day. For example, 1 egg contains about 4 grams of fat. They can then aim to go back to a normal diet within a month after surgery or as their diarrhea resolves. In very small numbers of patients, they may require continual medication for their diarrhea. If there have been no side effects from their surgery, then there's no need to make a permanent change to your diet. And I've been asked many times whether or not they can drink alcohol. There is no reason why you can't drink alcohol, but of course, if you're on pain medication following surgery, you need to avoid this. Most patients after gallbladder operations can return to work after 1 week. Because we perform this via laparoscopic techniques, we want to reduce the risk of hernias forming in the incisions of the abdomen, and therefore I always tell all my patients to avoid heavy physical labour for at least 2 weeks. In terms of driving, they can practice doing emergency stop in the car while it's stationary, and if they can do this, then they can start driving.